Hello, everyone. I'm Jen Rumbalski, the director of the La Crosse County Health Department. It's good to be with you today on this Friday at the end of January. It's been almost a full year since the health department released its first media update about COVID-19. We sent our first press release actually on February 28th of 2020. And the purpose of that press release was to take a look at where we have been or had been at that point. And today I want to talk a little bit about from that point, what we have done through that time, where we are today, and discuss really where we're going with vaccination and addressing some frequently asked questions that we know some of you guys have. So starting with vaccines, vaccines really do provide hope for the future and a path to some sense of normalcy prior to the pandemic beginning. We want to acknowledge that there is really a lot of interest in vaccination, and we're really grateful for that. There are also many questions, and we're glad to have so many who want to be vaccinated. And these questions are good things for us to be able to communicate what we know at any given time about vaccines. So bringing vaccine to thousands of individuals in our county and across our region and state does take time. We acknowledge that waiting is really difficult for many, and also acknowledging even some of our own staff in the health department, myself included, have not yet been vaccinated because we are not yet eligible. So at-risk populations that are receiving the vaccine for the first, receiving the vaccine first really are decided by the state. That decision is the state's to make. They tell us who is eligible now and who will be eligible in the future. And all of our vaccinator partners really do need to follow these guidelines. So we want you to recognize and understand that that is something we do not get to decide on. Those that are currently eligible for vaccine, just as a reminder, are the frontline healthcare workers, those that are in long-term care facilities, our most vulnerable residents who are 65 and older, and police and fire. And those that will be soon eligible on or around March 1st include teachers and those in education, childcare, those living in congregate living facilities, some public-facing workers like 911 operators, utility workers, food supply chain workers, and individuals that are enrolled in Medicaid. The speed of the vaccine rollout process is really limited by the availability of vaccine from the state and federal government. So we order that on a week-by-week basis, vaccinators across our county and region, and then we receive a certain amount of that order that we place each week. And we're not usually aware immediately of how much vaccine we will receive of that total order that is placed. So next I want to talk a little bit about public health's role in vaccination. So our local health department and local health departments across the state serve as community leaders, and our job is to assure that the population that is eligible for vaccines can get connected to the available vaccine. Again, the reminder that that limiting factor is the amount of vaccine that's available. So we work to connect that available vaccine to the eligible populations. And the health department is working closely with our community partners with this shared goal in mind. And the goal is to vaccinate as many people as quickly as possible when they become eligible in an equitable manner, paying careful attention to vulnerable populations. And again, the only rate limiting factor being vaccine supply. The health department has applied to be a vaccinator. We placed our first order last week. Nope, I apologize. We placed it on Tuesday of this week. So we anticipate receiving our first allocations of vaccine by the start of next week. We will begin to outreach and vaccinate specific populations, particularly those that cannot get to their healthcare provider. And we may begin with our county employees who are currently eligible through phase 1A, including those that are 65 plus, as well as those that are frontline workers, again, eligible through phase 1A. We are also preparing for and communicating with our public and private schools. We anticipate being able to vaccinate teachers and school staff when they become eligible and are preparing those clinics to occur in early March. We are working closely with those school administrators and nurses at the schools to ensure that we reach educators as soon as they're available, or I'm sorry, as soon as they're eligible to be vaccinated. So just an overview of where we are now. We have vaccinated many thousands of individuals that are residents in La Crosse County. We have 3 agencies that are currently vaccinating the eligible populations. So a huge thank you to those vaccinators, Weber Health, Mayo Clinic Health System, and Gunderson Health System, for serving as our current vaccinators and getting the vaccine into as many eligible arms as possible. The 65 plus population in our county is about 20,000 people, and it will take time for these vaccinators to get through this at-risk group. But again, we're all working very hard to go as quickly and safely as possible. Until we have enough vaccine for our population, really continue to emphasize that masking and physical distancing and hand washing are the most effective and proven ways to reduce the spread of COVID-19 across our community. These behaviors should be the norm right now and should continue even after receiving a COVID-19 vaccine in order to slow the spread of this virus. For this reason, we did update our local health advisory, and you may have seen that. We put that out today. The advisory now addresses masking in public places and directs businesses to follow the guidance that's provided by the Cooley COVID-19 Collaborative relating to occupancy. And currently we are at what we call high level of COVID-19 in our communities, and the mitigation strategy that relates to occupancy is at 50%, where previously it was 25%. So our advisory will now take into account what the collaborative indicates relating to occupancy. You will also note that our collaborative website, which is cooleycovid19.org, has been updated and includes a roadmap of how the guidance may change in response to disease levels and healthcare capacity that is experienced as we update that every other week. I want to address some frequently asked questions as well. So one frequently asked question that we receive is, if I am currently eligible, how can I get vaccinated? So people interested in receiving a COVID-19 vaccine can right now go to our website and complete what's called the vaccine interest and screening form. This is helping individuals that are currently eligible get to a vaccinator, and also includes screens for those that may not be currently eligible to let you know when you might become eligible and provide you with additional information. So the folks that should not fill out this vaccine interest and screening form are those that are considered established patients at Gunderson Health System or Mayo Clinic Health System, aged 65 or older, who want to receive their vaccine from their healthcare provider. And an established patient is someone who normally receives care from a primary care provider at either Gunderson or Mayo and has visited them within the last 3 years. For all others, we ask you to fill out that vaccine interest and screening form. And after completing the form, those who qualify will be referred to a vaccinator who would then contact the individual to set up an appointment. So completing the form is only needed one time, and we would ask that additional calls or sending messages, for example, to make sure your form was submitted, or to ask questions about when you might hear about an appointment, are really not necessary. If you complete the form and you hit submit, we will receive that form and the information within it, and we will be working behind the scenes to get you connected to a vaccinator who will call to schedule an appointment. Or I should say, it may be a call, it may also be through another mechanism. So how can I sign up if I don't have internet access or I'm not sure how to complete the form? We do have call center staff available to assist with filling out the form, and the number for those individuals is 608-785-6240, and that is also on our website. So please know that we are experiencing high call volumes. We have a lot of interest and need to support those that want to be vaccinated. So please be patient with us and know that it may take time, but if you leave us a message, our staff will return your phone call to help get that form completed for you. So another question we get is, once I get vaccinated, do I still need to wear a mask? Do I still need to social distance? And the answer is yes. Masking, physical distancing, and hand washing continue to be the most proven and effective ways to reduce the spread of COVID-19. And these behaviors should still continue after receiving the COVID-19 vaccine. Another question we get is, where can I find the most up-to-date vaccine information? We really take pride in being a source of accurate and timely and credible information for you in our community. So we recommend staying connected to our social media channels, as well as our website, lacrossecounty.org/COVID-19. Again, lacrossecounty.org/COVID-19. This is where we will be updating all of the information as we get it, and including eligibility groups for vaccinations. We will also share a weekly update with how many La Crosse residents have been vaccinated every Tuesday at 4 p.m. And this will also be shared on our social media pages and our website. So that is the content that I wanted to share with you today, and I will now take questions.
Hey, Jen, this is Tyler from WKBT. So earlier today, the health department issued a health advisory order. So can you go over what that health advisory is and why the health department put this in place?
Certainly. Thanks, Tyler, for that question. So yes, we did issue an update to our health advisory. You may recall we had a health advisory in the past. I believe we put that out in October. At the time, the health advisory specifically addressed adopting the mask mandate from the state. So it had the language in there about the mask mandate at the state level, and also included capacity restrictions at 25%. Since that time, we have had some changes across our state and our community, and we felt that updating that advisory would be appropriate. So today's advisory release is an update from the previous one that we did. So it's a second version, and it basically no longer sort of references the state mandate, but pulls the same language into our advisory relating to wearing masks. It also identifies that the capacity suggestions for 25%, 50%, and so on for occupancy in order to decrease spread of COVID would really fall in and coincide with the Cooley COVID-19 collaborative's decisions. And again, all of that framework for how those decisions are made is on that website for the collaborative. So essentially the advisory operates the same as it did before. It is updated to include the mask language. Please understand that the advisory in and of itself is not enforceable. How this process works is the advisory says these are important things for our community to take action on. And it says that if for some reason someone is not taking that action as it is advised, then with viable reports, typically that is law enforcement or some other means of receiving a viable report, then the health department sort of investigates, looks at that report or set of reports, and will issue an individual order for occupancy, for example, that might be to a specific business or establishment. And then we then would wait for if there was a violation of that specific order, again with viable reports to show that violation is occurring. Then we would move forward with additional enforcement action, which may include citation. So that's how the process works. Again, this is an advisory. It's meant to say these behaviors and these actions are important to decrease the spread of COVID-19 in our community.
And just to follow up on that, why did the health department, update its advisory? Does this have anything to do with the Wisconsin State Assembly likely ending the mask mandate next week?
Yeah, thanks, Tyler, for that question. The timing, I can understand. It does actually come at a time when there is something happening at the state relating to the mask mandate. But actually, we had already been working for the last couple of weeks on updating the advisory, really because the primary reason was because the collaborative had moved forward with a small work group that had developed some what we call mitigation strategies. So that might be what individual actions should be taken, what should schools and universities or businesses, what sorts of actions should they take based upon where we were in the community with COVID-19 disease levels. So this is what I'm referring to as being now on the Cooley COVID-19 collaborative website. And there are a set of different levels of disease. We're currently in the level called high, and therefore the strategy around occupancy is 50%. We didn't want to have our advisory still say 25% when we are now at a place where we can have 50% and still keep our community as safe as possible. So that was really the impetus for the update to the advisory.
Jen, we have a question from Riley. She is asking, how will the Johnson & Johnson vaccine, which is a single vaccination, how will that help vaccination efforts?
It's such a good question, Riley. I think any new vaccine that we can get in, mind you, we have to keep in mind what level of effectiveness that is. It has to be approved by the FDA. So it has to go through a series of steps. Yeah, I heard about that this morning as well. But any additional vaccine that comes into play, especially one that is only a 1-dose injection rather than 2, adds to the tools that can help us get to that goal of vaccinating as many people who are eligible as quickly as possible. So that is very exciting news to see. We've been waiting to hear about both that one and the AstraZeneca vaccine, knowing that at some point here we would see those come into the picture. More vaccines mean more people who are eligible can get vaccinated, which is very exciting news. Thanks for that question.
Hey, Jen, maybe do you have any possible idea how long this advisory will last for?
Yeah, that's a good question. I will adjust the advisory as it is necessary. So it will be in place until it is no longer needed or needs to be updated. So there's no designated time frame. But again, as time goes on, if indications in the community, disease levels, other things change, we will try to keep it as fresh as possible, either by updating, or if we don't any longer need that, because we get to a point with vaccination where we don't need to have that advisory there, we will be watching that, and we'll certainly issue additional updates or remove the advisory at the time when it is appropriate to do so.
Hey, Jen, this is Rick at WIZM. Is there any way to gauge how either the county or the state is doing with vaccinations? Because you'll see headlines out there, only 5% of Minnesota, I saw this headline, only 5% of Minnesota is getting vaccinated. Well, there's no baseline. We've never done this before. It's been 100 years since, we've had a pandemic like this. So, would the county be able to tell us, hey, we're doing good with vaccinations, where it's actually not going as fast or as slow as we want? Anything like that? Does that make sense?
Yeah, I think it does, Rick. As I answer your question, let me know if you have a follow-up. Essentially, we know, let me just start with sort of the way zoomed out picture. We know that in Wisconsin and in our county, the goal is to vaccinate about 80% of the population in order to achieve what is known as herd immunity, which means we have enough people who have immunity that we decrease disease levels to the level, that we can really get back to some semblance of behavior and normalcy prior to the pandemic. It will not ever be likely the very same, but that's the ultimate goal. A couple of considerations with that. Obviously, there's a big number of people over time then that need to get vaccinated. You can't do them all at once. And we continue to have the limiting factor of vaccine supply. How much supply does our state get? How much supply of all the vaccinators across the state, what they are requesting each week, how much are they able to get? Every week is a little bit different. Up until a couple of weeks ago, supply was what was being requested for the most part was being honored from the state. Now the number of vaccinators increases, the number of vaccines needed for the 65 plus population increases, the amount of vaccine at the state level does not increase, and therefore you have that supply and demand piece where not every dose that you request are you going to get honored by the state because of that vaccine supply piece. Another consideration is that the vaccines we currently have available are not for anyone 16 under the age of 16. So we have to keep that in mind, that if you look at a goal of 80% of the population, we need to consider the fact that a large chunk of our population cannot get the vaccine because they are under the age of 16. So right now, the best source of information, Rick, is really the state has a website that identifies by county the number of vaccines that have been given. So that is the best way right now for the tracking of vaccines by county and at the state level. Over time, I'm sure that those data sources will get better. But again, early in the process, that's the current available information we have. I believe we are also starting to put something out on our either our collaborative or our website to indicate vaccine amounts for our county residents. But I just kind of reiterate that the supply is still not enough to meet the current demand. And that is why we see individuals becoming eligible in groups rather than the entire population at the same time.
Jen, this is Abby at the health department. Riley is asking how many people have been vaccinated. And Riley, I do have that number. That's 12,596 currently. And that data can be found on the Department of Health Services website.
Thank you, Abby.
Okay, so I'm on that website, the state website, and it says for La Crosse County, 794, and I think yesterday was in the 800s. But there's no baseline, so is 794 good, bad? Is there an average? Will it just keep going up? Is there a way to just go, you know what, we're doing good with 800 a day, or that's terrible?
That's where I think that total number that Abby just mentioned, and that does come from the Department of Health Services website as well, Rick. So maybe offline we can connect to make sure we get you to the right portion of that site. It does give a total number. And so when you start at 0 for a county, and then you're adding amounts per day, the 12,000 number then is how many over time since vaccines became available. That's how many residents are currently vaccinated for La Crosse County.
So does this advisory mean that businesses like private and small businesses still have their own power to create their own mask policy, or is this something they have to follow through the county?
You're really quiet, Tyler, so I'm not sure I caught the entire thing, but I think what you're asking is, would businesses be following this advisory? And assuming that whatever policies they have in place, we're following the mandate at the state already. This really is the same language, and so this shouldn't be a significant change for them. But any business that is connected to the health department, we are communicating with them to let them know about this change as well. And yes, we would ask that these are the advisory guidelines that be followed relating to masks.
Do we have any additional media questions for Jen today? I'm not seeing any, Jen.
Okay, well, thank you all. I want you to know that a really good chunk of entities, including the health department, are working very hard to get vaccines to those that are eligible. And we will keep you informed on our website and our social media sites about where we're at as a community with the process of vaccinations. We aim to make that as organized and as efficient and effective as possible. Knowing that some of the factors are not within our control, including vaccine supply. And as a reminder, in the meantime, please continue to wear your mask, physical distance, wash your hands. Those are the ways that we can continue to keep disease levels low and decreasing in our community, so that we can keep schools open and we can continue to have businesses functioning, all of those really important aspects for our community. So thank you all for your time today, for your questions and your interest, and appreciate you, and have a great rest of your day.